Mhm. A hearty, healthy and good evening to everyone present over here. You never know, everything seems nearly fine and perfect until your bed starts to have its highs and lows. Nobody wants to take chance when it's a matter of the heart. A hearty evening to everyone present over here. Myself, Ipsha, the host of today's session. The Entrepreneurship Cell VSSUT brings you the most awaited webinar, Spandan, an ECG machine, a game changer in the health sector. The successful pitching and equity gain of Sunfox Technologies in Shark Tank India got a vast distinction for its great innovation of Spandan, the advanced portable ECG device. Spandan is recognized as the most detailed ECG machine that detects 21 classified arrhythmia, 12 heart dysfunctions. The notable effort of the whole team towards blending health technology and entrepreneurship to improve the cardiac condition is a big step for the real world. So, congratulations to the team. Today we have with us the stout-hearted man, Mr. Arpit Jain, director and co-founder of Sunfox Technologies. I welcome you, sir, to the webinar. Without further ado, let's hear from the man behind this amazing innovation.
Thank you for the introduction, Isha. A hearty good evening to everyone. Thanks for having me here. Most of you know me, and some of you not. Let me tell you, for those some, that I am Arpit Jain, co-founder and director of Sunfox Technologies Private Limited. We are an R&D company based out of Valley of Uttarakhand, Dehradun. Our flagship product is Spandan ECG, as Isha told, is primarily heart monitoring device which works with a smartphone application. So please, that's it. So from our side, you have the introductions and all that thing, but now you can start with the questions and all that thing.
Yeah. Sir, definitely, sir. Whenever I hear the word Spandan and this great idea, I mean, how did this idea of creating such an innovative machine, which has literally brought a notable change to the health sector, struck you back in Dehradun? I mean, what inspired you? What was this driving force behind this idea?
Actually, we all are coming from small towns and village. We have seen the lack of medical expertise and equipment over there since our childhood. People die due to unavailability of medical services and facilities. If I talk about the death rate due to heart attack reported by WHO, after every 33 seconds, every one person died due to heart attack. So these are the numbers. These are the factors which are actually fueling us to do more in this direction. ECG has been invented 100 years ago, and still it is out of the reach of last mile peoples. So we thought let's build something so that no one die due to preventable heart attack. So these are the major challenges we are targeting, and we are just focusing on these factors. That's it.
The presentation of your startup in Shark Tank was really impressive. I have to admit that. But whose idea it was? Like the Shark Tank, going to Shark Tank and this all set up. Whose idea it was?
So, don't you think the brains at Sunfox teams are creative enough to make people laugh, feel loved, and still communicate this problem of the world? Obviously, it's a matter of the credit goes to my amazing people, and yes, a big thank to Sony team for curating our pitch. So, that's it.
So everyone saw like how involved and interested were the Sharks for Spandan. So do you think you could have negotiated more for the deal? Like the deal was finalized, but if you have any, you thought that maybe it would have been better. Anything?
Could you please repeat the last line? Actually, I didn't hear you properly.
I was saying that the Sharks were so much into your Spandan, the technology. They were so involved and interested. So do you think you could have negotiated more for the deal?
Actually, mind is
The
always.
negotiation process.
Yeah, understood, understood. Mind is always gives us full of
Yeah.
options and queries in every situation. It's up to us to decide what is most suitable option at that time. All the are willing to give us their knowledge and expertise for our product, and they also providing us the market accessibility. Also, that at that time we thought that this is the suitable options to choose. I would also like to add one more thing for the negotiations part. If I'm talking about, yeah, we did negotiate for the stakes, but it didn't telecast at the Shark Tank episode. So we did negotiate. It will around half an hour for the negotiation part actually, but they didn't telecast for that.
So it
Yes,
is very rare to see actually that all sharks deal. It is very rare. So, but
yes,
I think the product totally deserved it. As Namita said, it will be a complete game changer for the world. So,
yes, yes.
how did you feel after getting offers from all five of them?
It's a very obvious and exciting feeling when you see all the sharks coming on the board. The sharks have been of a great help so far, and we see a great journey ahead with the help of all sharks and all the teams, basically. So I'm working with them.
Obviously, it is much late and overwhelming for you guys. It's like a step towards a bigger milestone, I would say.
Yeah, you can say that. I think that was.
So, well, yeah. So as of now, what changed after Shark Tank? Matlab, undoubtedly, it would have given you much reach and marketing after the stream. But how has the growth, in particular, the momentum of the startup is affected
Mhm.
after the Shark Tank episode and everything you got, the deal?
Things has been quite changed after Shark Tank. Shark Tank gives us the visibility we require to showcase our brainchild Spandan ECG device to the world. We are working from past 6 years to build this Spandan ECG device, and after so much of the efforts, we needed a platform that can take us this product to pan India. Shark Tank did exactly that for us. So Shark Tank gives us the visibility we require for our product, basically. So this is the uh, things we have thought that changed after Shark Tank.
So it definitely boosted the momentum of the startup.
Yes, it it has been increased the momentum. It got us the visibility. It gives us the idea that how that the market is acceptable with our product, and the market is boosting and accepting our product. So it's good. It's good. So this Shark Tank is happening, and it gives us the visibility basically. So main part was the visibility. So we did earn for that. So yes.
Definitely. Talking about visibility, I think
Uh-huh.
the rural India is still quite unaware of the modern technologies, especially when I speak about education sector as well as the health sector. It runs so much parallelly. They're much deprived of rural India are much deprived of these facilities and modern technologies. So, what are your thought for this device supposed to reach rural areas in particular? How will you make that possible?
Okay. Uh, Around 70% of the population is still in rural India. Sunfox journey started with a
Mm.
vision to build it for Bharat centric. And if we found that it is a good fit for India as well. Rural population, which I am referring as Bharat centric, uh, Bharat centric here, is lacking of availability, accessibility, and awareness about their heart health, and which led to delay in the medical treatment, so that the mortality rate is very high. Through Spandan, we are reducing this gap and building a solution which can be available when you need it the most. We are penetrating and educating rural population at various channels. Today, you go to extreme hills in the Uttarakhand where you have to trek 3 to 4 kilometers to reach a village. You will find Spandan saving lives there. Be it tribe of Nagaland or Tamil Nadu, be it Assam, or even a tier 1 city. Spandan is already saving lives at 1700 plus pin codes. So this is.
So what did you say? Like, has it achieved the milestone of reaching rural India completely, or you are on the verge of, or you are halfway there? What will you say? Matlab, what is the rating? How much has it affected?
We are just giving our best, basically. We haven't touched and uh, touched every single life in the rural India. If I am talking, this is the actual phase. But we are trying our best to touch every pathway and roadway and every medical facility at the last mile connectivity. Basically, we are just making that possible through our initiatives. Through we are working with NGOs, multiple agencies, hospitals, and other channels to make it happen.
Yeah, surely. I can say that this is so true because I want to say to all the viewers watching this, I have gone through some of the posts, and Mr. Muzamil is the director of Global Youth Corps and a resident of Jammu and Kashmir. So he is happened to a founder of a non-profit organization that operates in the rural part of Jammu and Kashmir to give free medical and health service to the general public over there.
Mhm.
And he happens to provide free ECGs to his clients with the help of Spandan. I
Yes.
mean, people have really accepted the device to a greater extent. And not only that, they're ready to help even. They're raising their helping hands for you. So how do you feel about this? Like people are ready to accept these things.
Actually, there are two factors. Actually, we are for availability of ECG. If I'm talking about the medical grade ECG, which are happened available in hospitals, so it will cost you high. So the patients at the last mile connectivity, they are uh, uh, avoiding these type of tests due to the uh, high prices or something like that. So with Spandan, we are reducing that space, that prices. We are reduced to just even reduced at 10 rupees per test. So it will make the possibility to can test every person at the last mile connectivity. And if I'm talking about the Dr. Mujammil at the last Jammu and Kashmir, so he is very good doctor and working with us from past few months, and he's quite interested in the product, and he's doing very well through Spandan ECG, and the results are quite good. And if I'm talking about the last mile connectivity, doctors are not much that much knowledgeable. I have that much type of expertise to interpret the clinical grade data of ECG. So they need a complete layman interpretations to tell the patient that it is not that much serious or what is the exact scenario of his heart. So through Spandan, he is able to do that. So I think that would help him to serve motor better in that. And it's obvious and extremely happy to see these type of doctors are accepting the Spandan ECG device and working with us. It's very good feeling.
Yes, and not only like in India, I I saw that some cardiologist back in Turkey,
Mhm.
he's also so much interested in the Pandan technology
Yes,
that he has also admired you guys.
yes,
So
yes.
it's worldwide, like everyone recognizes the product.
Yes, 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 yes. So I just tell you one instance about the cardiologist over Turkey. So we haven't selling and started our operations in Turkey and in this type of countries. So he contacted us and said, "Sir, please provide me Spandan ECG device. I need it more." And we just mentioned that we haven't started our operations there yet. So when we started our operations there, then we will provide you the devices. So he tell me that he can't wait that time for that time. Just provide me the details. I'll just send you the payment and just send me the device. I'm so interested to use this device, and I'm super excited to use this. So we just for filed some regulations, and for uh, after filing of this diagram, we just made that happen, and he's using that device. and completely happy. He gave us the feedback, video, and multiple feedbacks from the device after using the device, and he's completely happy with it. So that's good.
Yeah, definitely. Such stories must be so much inspiring and gives you so much strength. The idea, like the main motto of this product or startup, I would say, is somewhat achieved. You guys were almost there. Like it is helping the people not only in the nation but worldwide. Like people are really interested in it.
Yes, yes, yeah,
Yeah.
it's quite good.
So talking about yes. So talking about Shark Tank. That episode, you have mentioned that about testing the product with 10,000 patients with gold standard to find the accuracy of the device. Can you just brief us? How did you do this?
Uh, we organized the clinical health camp and clinical observational studies at various hospitals under the supervision of hospital ethical committees. To do that, some of the test was done by our user, which are normally includes cardiologists and physicians during the pilot studies, which provide us the feedbacks and the user experience feedbacks. So through that, we test our product and find it the accuracy about it.
Okay, basically quite impressive, I would say. Presently, the technology focuses on early detection of faults, right? So, have you thought of any improvements for the future? Any newer feature you would like to add? What are the improvements planned, basically?
Uh, if if I'm talking about the improvements, the actually uh, with the Spandan ECG device, we are doing early detection of the heart disease even today. Spandan is getting smarter every day, and we will be capable to suggest the lifestyle routine, heart health predictions to reduce the future heart problems. So Spandan is getting smarter every day. So with that, we are even focusing on various things. So it will come soon. So you will find it.
Yeah, we hope to find it soon because it's so interesting about the product. So, have you guys planned to further bring down the cost of Spandan? Like, how are you going to do it if at all you are planning so? Because for rural India, if supposedly say if we want to target, if you guys want to target to the rural India, and have you planned to minimize the cost in some way so that they can afford or
Yes, yes, yes. As I mentioned, we are planning to reduce the cost of ECG, Spandan ECG device in future. As this is a product we have developed in house, and we did all the research by ourselves. So there is always have the option to offer more, whether in terms of prices or in terms of specifications. We are working on the both, and if in future we will offer more specifications, more offerings, and more features in Spandan ECG device at a reduced cost. So we are working on that thing.
nice to hear that. Well, the most general question: how many times your idea was rejected before finally getting funded in Shark Tank?
Okay. So so many times. uh, इतना की याद भी नहीं है काउंटिंग ना सीरियसली देयर इज अ नेवर स्मूथ पाथवे फॉर अस चाहे वो रिसर्च में हो प्रोडक्शन में हो या फिर फंडिंग के लिए we always work hard to get into the mind of people when we are presenting our idea. Sometimes they never believe, and sometimes they didn't even listen our preach, not interested at all, thinking we are immature kids because we are not coming from big institutions and having no business backgrounds. So yeah, there is so many rejections before Shark Tank. I, I just had a one instance here. So I'll just tell you about it. So you are all comfortable in Hindi, na? If I'm saying any words in Hindi, so you are all comfortable with that, no? So I
Yes.
just so I just share one sense you can relate to that. My parents, started taunting us when we used to go to any investor meeting कि तूने कोई investor छोड़ा है इस इंडिया का जिसको तूने pitch नहीं किया हो. These are these type of things we have faced through. So there is so many rejections, yeah, before that. So rejections तो बहुत हुए.
Yeah, I guess rejections and hurdles you can say are very common when you work for a bigger cause like one your team is working for.
Yes, yes, yes.
But it never stops you. There's no halt when when you have a bigger cause in front of yourself.
Yes, 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 yes. True, true. It's completely true.
Yeah. So how did you actually yes. So how did you endure those difficulties and challenges? Like saying about the club, our club's the entrepreneurship cell. Prime focus is on entrepreneurship, enhancing entrepreneurial mindset among all. And so as we got some budding startups even. So if you can share your experience, how you dealt with those difficulties and challenges, it will be much inspiring for everyone.
Mm, So uh, Dehradun played a critical role here. Uttarakhand is called Devbhumi for a reason. Can you even imagine of negativity as Devbhumi? Whenever we had that feeling, we just used to go and sit in the lap of nature and enjoyed those moments. Even nature heals everything. And if you are working with a noble cause or you are working on project that you feel that it will help many lives in future, so it will help you and heal you for the to do more. Even if you are facing difficulties there, so these are the factors that help you to do more and from the cope up to from the difficulties and negativity basically. So for in our case, the Dehradun plays a very good role if I'm talking about the nature and Devbhumi. So it's played a really big play. And if you are doing anything and you are working in any startup or any project, so you have to do 100% of yours. देखो डिफिकल्टीज का ऐसा नहीं है कि वो नहीं आती हैं, ऐसे बिजनेस में ही आती हैं. You will find difficulties everywhere, even in studies. If I'm talking about studies, if I'm talking about job, difficulties are common everywhere, no? So why
Yes.
bothers about it? So you just focused on work and just do whatever you can to do, but just give your 100% so that you cannot have the guilt कि भाई यार पहले ये कर लिया होता, 100% दे लिया होता तो शायद आज पिक्चर अलग होती. Just do your 100% and nothing else. After rest is all.
Exactly. There's no time for regrets, I would say.
Yeah. There is no regrets and difficulties तो आती हैं वो. There is no escape for that, no. So if you are in any segment, if you are in any field, you will find difficulties over there. And difficulties का ऐसा भी नहीं है कि मतलब बहुत ज्यादा आती हैं तो वो बहुत आपको परेशान कर रही हैं. Difficulties makes you perfect, no. It's my opinion. I don't know what everyone says, but it's my opinion actually.
Yes, matlab, the basic thing is when you're dealing with negativity, then you just have to ignore those things, those stuff, and you have to stay focused on what you would really want in your life. I think that's the escape strategy when you face negativity.
Yeah, not ignore everything. Just some of difficulties can be ignored, and most of your important thing you have to learn about that up from the difficulties basically. So if you learn from that difficulties, maybe in a startup we are facing I'm not that much technical because I didn't in engineering background. I am a commerce background, so I'm more into finance. So फाइनेंस में इतना ज़्यादा टेक्निकलिटी होती नहीं है. इंजीनियरिंग वाले ज़्यादा टेक्निकल होते हैं आई थिंक, जो जैसा मुझे लगता है. सो डिफिकल्टीज का तो ऐसा कुछ है नहीं, तो मतलब ठीक है, इट्स कम्प्लीटली ऑल राइट. सो आपको स्टार्टअप में है तो डिफिकल्टीज तो होती हैं. आपको लर्न करना चाहिए कि वो डिफिकल्टीज से आप कितना ज़्यादा सीख सकते हैं, कितना बेहतर बन सकते हैं. दैट्स आई एम टॉकिंग अबाउट.
Yeah, definitely. It's about the learning process during these times.
Yes. Completely. Learning is never get stopped if you are at any position.
So, talking about the current situations, currently you are representing the whole country in a global scale. Viva Technology 2022.
Yes.
How is it going? If you can share your experience.
Uh, It's going well. If I'm talking about the Viva Tech event, which is happened to be in Paris, France. So it's if I'm talking about in the layman language, which financiers are used to have most of the time. So it's a kind of the biggest event of startup, basically happening, organized by uh, France, Paris. So India is uh, uh, India is, I think, it was the first time India is representing their startup culture over there. So when it is the first time, and we are shortlisted by the PMO, Niti Aayog, and Department of Industries and Startup India to showcase our to represent India over there. So it is obvious, and uh, it's very obvious to proud that much seriously keep that you are representing your country in other country and in front of world, basically. So it is extremely proud moment for us, and बहुत अच्छा experience था seriously when we got us the mail. So it's seriously बहुत अच्छा था.
We do believe that the experience would have been mind blowing because it's a proud moment for us. Like getting known and recognition in a global scale is a big thing to say.
Yes. It's always.
I'm saying you this idea. Yes, this idea got no hold from Shark Tank to getting acknowledgement from Honorable Prime Minister Sri Narendra Modi, getting all the love and applause from around the globe. People are sharing stories with a device, and now Viva Technology in Paris.
Yeah.
So say me, what's next? What is the next in the checklist?
What is the next?
Yeah.
Uh, our journey has just started actually. A long way to go. Multiple products and generations of technology are on the way. Stay tuned. You will find it. So we are working on various technologies and products. So we are that these those are the in pipeline. So we haven't talking about that technologies, but they are in process. You will find it.
Okay,
Stay
we
tuned.
will wait for that. Definitely. Fingers crossed for something new and something which really makes us more proud. I don't know what this idea would go. I mean, this is so much future. So yeah, I think well, our viewers got a lot of questions to ask. It's time to open for Q&A.
Yes,
We
yes,
are
yes.
live the YouTube itself and here in the meet. So I will take some questions and you
Yeah,
can answer,
yeah.
I guess.
Sure. Please.
Yeah, let me see. So there's a question that have you thought of providing Spandan ECG device at a government subsidized rate if the government offers you the opportunity, like collaborating, I guess, if he's talking about that.
So we are working with various government agencies and hospitals to provide this Spandan ECG device. But for that, there are some procedures and regulatory to done before. So government is following the channels, basically, if I'm precise about the thing. So we are into the process of working with the Sunfox government. So very soon we will working with the the government, and reducing this reduce this cost and provide us that last mile connectivity with at government facilities and all. So we are working with several government state governments to provide us provide Spandan ECG device at PHC CHC level. So it's called primary health care and CHC. It's मतलब जो community health centers basically. So we are working with on the that thing else also, but it's the government association, so it will take some time. So that's why. But it is in the process. Very soon we will get it done. And we are working with the army also. We are armed forces also to provide Spandan ECG to them also at a high altitude and also in the remote areas also to basically monitor their heart health. So they are in it all are in the process, but not very soon we will get it done.
Okay. I think there's a question from Satyanarayan. How did you structure the pricing of your device, Spandan? And what are the early challenges you have faced while selling those units?
Actually, we have conducted user UX and UI surveys to exactly grab the market feedback about the prices, if I'm talking about. So we did some various surveys to check what is the market acceptability for this product, at what rate the market accept it fully. And also we have a thought to provide it to provide the Spandan ECG at last mile connectivity. So there is also a thought that we will have to be put this the price very low, so that at the last mile connectivity every person can afford it. So we did that survey.
Okay. I think Satyanarayan got his answer. Abhijit asked, what is the strategy you go with in terms of stake when it comes to getting funded by the investors?
Sorry, just
I think it's in the chat. I
yes.
repeat, what is the strategy you go?
So we are in the conversation with investors, and they pitch their ideas and their expectations from us in this aspect of equity. And we have thought in our minds that if it comes to equity, then what is our future plans and what are the exact equity we have to dilute at this time. So we have our panel, we have our advisors, our teammates, our parents to discuss this thing, and after that we will ensure what is the stake uh, to dilute basically. So it's a matter of the discussions basically. It's there is no strategy for that thing. It's a matter of strategy and to know what is the good what is right at that time for your business also. So you cannot dilute more equity at some lesser prices, and this because you have to raise another round in future also. So you have to think about it all. You have future plans and something like that. So something.
Mhm. Definitely. So Arpit asked that how did you overcome the obstacles and keep yourself as well as the team motivated for 6 long years?
Uh, it's a team play basically. So when one person feels demotivated at that time, so another one is uh, pushing him to do even more and motivates him. Basically it's a team, so everybody is keep pushing each other to work more. And sometimes even our parents, even our advisors, sometimes our uh, doctors, and sometimes if I'm talking about, so if someone is using a Spandan device and they gives us a good feedback, and if you find out that if you go with any investors or some uh, pool angel investors round and they found it very interesting, these are the things basically fueling us to do more. And if I am talking about startup culture, so in startup uh, Startups are all about the journey, never about the destination. मतलब if you are in a startup, then तो buckle up your seat belts and सफर का मजा लो बस. It's all about the journey, no? So you have all a long journey basically. So destination का बहुत बाद में आता है startup culture की अगर मैं बात करता हूँ तो it's good.
Yes, I think all those struggles and hardships get worthy enough when you actually see the thing you are achieving. Slowly might be, but at least you have started achieving things. So those struggles and hardships seem so much worthy now.
Yeah, completely. Without hardship,
Again,
you didn't reach anywhere, no? You have to do
yeah.
work. So.
Okay, so we have another from Satyanarayan. Do you have any advices for the emerging entrepreneurs who are trying to solve a problem in the healthcare sector, particularly, he asks? So, where do you see the future of healthcare sector in the upcoming 10 years?
So if I'm talking about myself, I'm thinking about I'm talking about the future of healthcare sector. After COVID, we are seeing that the future of health sector is growing very fast. There's emerging various startups, various other conventional businesses are there. So there is very big market and very big scope for the healthcare in future. So if you are in healthcare sector, just do everything you can do. Best time है करने के लिए. और हेल्थ केयर में है, सो यू जस्ट फाइंड आउट व्हाट इज द मार्केट इज एक्सपेक्टिंग फ्रॉम योर साइड, एंड यू कैन व्हाट यू कैन सर्व इन better way to the society. If you are in a healthcare, you have to give more to the society, uh, uh, without expecting from their side. So it's kind of that kind of market. It's kind of that kind of segment. So just giving your 100%. That is yes. वो आप बाकी चीजें सब सीख जाओगे आप टाइम के साथ ना.
Yeah, definitely. Time teaches you a lot.
Hmm.
So here's a question from Lalit. A lot of data is generated when people use the Spandan ECG device. So have you thought of using the data to analyze and provide good insights to medical agencies and pharmaceutical companies to bring new cures?
Yes. We have more in device company and data company. So we are working on the data as well. So we are having with our pharmaceuticals companies and medical agencies to work on the data, so that we can exactly figure it out. It's about the geographic in particular geography, what is the health scenario of the peoples, and what kind of medications they are using, what kind of physical problems they are facing. So yeah, we are working on that thing also. Spandan ECG is getting smarter every day. So we use that data to provide many things also. So this just like if I'm talking about like uh, healthy hearty health, or मतलब even बहुत if I'm talking about like कि what is exactly जो स्पंदन है वो बहुत सारी चीजें आपको आगे स्मार्टली बता पाएगी. सो डेटा इज एवरीथिंग nowadays. Exactly.
So here's a question from Sandeep. How do you see the impact of ABDM in Indian health sector and impact of UHI in digital health ecosystem of India?
They are doing very well, seriously, right now. I'm not that much aware right currently from those impacts. I'm actually keeping ourselves busy in our no, sector, so we are not that much aware about it. But as I heard, they are doing very well in the health sector and digital health ecosystems, basically.
So what's the real idea or what's the real thing between why you have just chose the word Spandan, why you have chose to name the device as Spandan.
So Spandan is the
Why Spandan exactly?
yeah, I'll tell you. So Spandan is the Devanagari translation of heartbeat. So Spandan is the main word for heartbeat actually. So we are just working on the heartbeat.
Yes,
So that's why we named it Spandan ECG device basically.
definitely. As the name suggests, it does the work very perfectly.
Yeah.
So, Prajam, I've asked you, how would you advise the students in managing the healthcare equipment finance?
Finance. If I'm talking about finance, there is no category in finance. If you are in any sector, there is only these two things happening in finance: cash inflow and cash outflow. So there would be sales and other things. So from there, that you are generating cash flows in the business, and some expenses are over there. So you are just outflowing the cash from there. So in healthcare, I don't think the category in and the segment uh, उसकी वजह से कुछ फैक्टर्स हो जाते हैं जो आ जाते हैं एक्सपेंसेस में या सेल्स में, बट ऐसा कोई सेक्टर डिफाइन नहीं करता है फाइनेंस में. आई डोंट थिंक सो.
Okay. I guess Flavy has a long question. We all know that Tim's speech was one of the few pitches that made on the show and succeeded in bagging the all shark deal. With
With
this, the revenue has increased 40 times and also you reached for distribution as well as partnership. After having this, will you share with us the current scenario of the team it will proceed to and the next steps it will deal with?
Yeah, so the current size of the team is very big. So we have around 65 plus people with persons was working with us, and there are some steps, and we are just planning to uh, increase the team size to 200 plus in the current financial years. We are just moving that thing. The distributions and partnerships are wo- goes quite well. We are having various offers for distributions in India through Pan India, or if I'm talking about in abroad as well. So we are working on that thing. But if I'm talking about partnerships, so we are getting offers from the partners all over India, all over world basically. So we are working on that thing also. We have some partners, associations for research, developments, and many more. So after Shark Tank, we will working on that field also. So the current scenario of the team was after around 65 plus. So we are just building the team so that we are just uh, and expand our production capacity, our reach, our branding, our HR, or something, sales basically. So we are just working on that.
Okay. So we have a question from Subham. Hello, sir. Oh, okay. What are the certifications you have applied to get the products commercialized?
So if I'm talking about the product regularization, so regulatories and laws are very neutral in India for medical devices. Precise about medical devices. So there is an agency called CDSCO, which provide the licenses and NOCs to all drug and for medical devices. We are a non-invasive device which is not going to insert in your body. We are just uh, taking results from just patching the electrodes on your body. So for that thing, we don't need any specific license. We just need NOCs and permissions from the CDSCO. So they have the office in Delhi. We are just to meeting them, pitch our product. They have some testing labs over there so to test the product. What is the basic things working to understand what is the exact working of the product and the thing. and after that they will issue the licenses and NOCs to us. These are the basic certifications we have. After that, we will have C certifications, ISO, product certifications. There are various things. These are required for India. If I am talking about abroad, so there is a certification called FDA. So to sell the product or to operate in US and UK market, you have to be FDA certified. There is some other certifications also, MHRA and NMIMS. So they are also there. So when you are growing with your product is growing and you are commercializing it. So my best advice is to go step by step. Just we just plan for a pan India first, and then we will go for the abroad.
Yeah, definitely. So Lalit has a add up to the question previously asked. So he asked, Spandan ECG is tested against gold standards and tested on 10,000 patients, I guess. Yeah. So can you give us an idea on how you approached this? How did you manage to get so many people for testing the device?
So as I mentioned that we organized health camps and various clinical observational studies at various hospitals under the supervision of hospital ethical committees. So you have to take permissions from those ethical committees, the hospital supervisions authorities basically for that. So after that, if you got the permissions, then it's accessible to have the patients and to test those patients at the same time when they are testing with the gold standard, and you can use your device with them. So it's about when it's have to you have to take permissions from the ethical committees of the hospitals, and also we have some cardiologists in our panel. Those cardiologists test these Spandan devices and then give us the first feedback as user experience feedback. So that would be helpful. Through all this, we reached 10,000, more than 10,000 patients, I guess.
So currently, Spandan device is available on Force e-commerce or healthcare platforms. So what is the reason of not expanding to other e-commerce platforms?
We are expanding. We are currently available on Amazon, Flipkart, 1mg, Pharmacy, NetMeds, on our own website. We are working with other platforms also. We are in pipeline with because there is some agreement, some legal framework to add the product and list those products over the platform. So we are working with them also. We have Medica Bazaar there, and we have several other platform also. We are just working with them. We want to available this device at every platform, so we are working with them. It's a time talking process, so थोड़ा होता है.
Yeah, definitely. थोड़ा time लगेगा, but we will reach the milestones.
Yeah, understood. Completely. We are completely उसके लिए हम बिल्कुल तैयार हैं, उसी के लिए काम कर रहे हैं. So it's 7 o'clock. If I'm talking about मेरा ऑफिस फुल भरा है अभी तक. There is no hurry in every employee of mine. So there's no work with they are not working for the money in Sunfox. They are working for a cause. They are working with us for it.
The cause is bigger than anything.
Yeah, that's why.
So are you planning to lower the prices as the business expands so that it can reach every nook and corner? I think he answered it
Yeah, we are
before even.
Yeah. We are just planning to reduce the prices, and we are just actually planning to offer more specifications and more features with Spandan ECG device at the lower price. We are just working with that, on that, because it's an in-house product, so we have all the research, and we did all the research, and we have that there is always an option to reduce the price, and always the option to offer more in terms of specifications and uh, features. Yeah.
So, talking purely about entrepreneurship,
Yeah.
what are the challenges you have faced on your early days of startup?
uh, Challenges are always there. In starting, there are many much more challenges that we are facing, but अभी आदत सी हो गई है ऐसे जीने में, so it's completely all right. So nothing else. बहुत सारे challenges आते हैं, अभी
News,
तो याद भी नहीं
yes,
होते कि
yes.
क्या क्या challenges आए थे. we are we face challenges in every segment, as I mentioned before, चाहे वो प्रोडक्ट की कैटेगरी में हो, रिसर्च में हो, प्रोडक्शन में हो, मार्केट में ले जाने के लिए हो. We faced challenges everywhere, from the funding to market. We have faced every challenge over there. So अभी इतना तो मेंशन कर पाना बहुत पूरी रात लग जाएगी, इतनी लंबी स्टोरी.
Exactly. So, what are the, what are more products we can expect from Sunfox Technologies planning to launch in the upcoming years? Like ECG is being one, this what nice.
So
What are others?
yeah, we have a 12 lead ECG device. We have bedside monitor. We have BP monitoring. So we are working with the various products. So these are the three which are coming into the market after in this year only. So after all other mm, uh, products are in the pipeline, and also we haven't tech confidential right now, so we are not talking about that thing. But yeah, there is very many products in the pipeline, and in the coming financial, if coming years, we are introducing many products into the market. uh, I give you three products: bedside monitor, 12 lead ECG monitoring device, and a cuffless BP monitor, basically. So these are the three I'm give you the idea about. But yeah, there is there are other more products to launch.
So, talking about this product launch, is Sunfox Technologies is purely, its aim is on health sector, or it is going to expand to other sectors even?
Yeah, we are currently focused on medical healthcare, basically. We are just more into
Okay.
portable healthcare industry. So after that, we are working on the other platforms and other sectors as well. But right now, it's not. We are completely into healthcare.
Okay, we have another question from Sugam. So, what are your opinions on getting quality certification from medical research institutions? Have you any plans on it? If yes, will it add a bonus to your marketing?
So my medical research institutions will provide the certifications over the medical products. Yeah, it's completely true, and it add a bonus to the marketing. Research institutions. So yeah, this gives the comfortness and reliability to the customers. If I'm giving you an example, if you some medicines advised by AIMS Delhi, so it gives you an idea that it is, yeah, ये अच्छा ही होगा क्योंकि वो एम्स ने certify किया है. It's kind of, it gives you the, it's always there. It's always add a bonus to the marketing. Yes, completely.
So,
And we are
there's an
working.
interesting question
Yeah, we are
that
working with.
have you
Uh,
visited Odisha?
Sorry.
So, there's an interesting question that I skipped. That have you visited Odisha?
Yeah, I have visited Odisha once when we are working with an NGO. It's called Swasth Swaraj. So I have visited Odisha. There is a place called Bhavani Patna over in Odisha. So I have visited there some years before, and we are working working with some NGOs to provide to gather to gather the informations and the feedbacks about the last mile last mile peoples. So when there at that time I visited Odisha once actually. So in yeah, I just know the name. Bhavani Patna is the name, and some other cities I have visited at that time. And Odisha is beautiful. Seriously, बहुत अच्छा था.
Thank you, sir. We would like to be your host sometime if you come again.
Yeah, sure.
VSSUT would like to host you someday.
Yes, yes, yeah. I'm more
Sure.
than happy.
I think we don't have any more questions.
Uh,
We will wait for 1 minute, and if not, then we can.
yeah, we will wait for 1 minute. If anybody have
Yes.
questions, so I don't want कि यार छूट जाए. If I'm talking about myself, so it's always man. I'm a chartered accountant by profession, so I haven't visited any college yet. So engineering college वाले मुझे मतलब engineering colleges are always awesome. So there are always awesome people in the engineering them. So there is a saying that all this intelligent and uh, best best minds you can find it in engineering colleges. So it's a good very honor to have in you all over there. So
Thank you so much, sir. I think that will be it.
mm,
So it was
thank
an
you so
amazing journey. What an amazing journey.
thank you very much, thank you very
So
much.
completely justified you calling. Yeah, completely justified. I mean to say, calling you guys stout heads. So high spirited, and this never give up attitude is commendable. It's really a proud moment for all of us to see an Indian startup reaching such heights while changing the fate of the world towards a, I would say, a better future. Really, sir, thank you for joining us. It was great having you. I think
Thank you.
everyone is so much overwhelmed to have you.
Thank you everyone for listening me patiently. Best wishes all of you for the future. And if you need anything, uh, if you need any time, we will have more than happy to help you. Us. We will always happy to help. Thank you very much. Thank you very much, all of you.
Thank you, sir. Thank you.
Thank you.